Let's see one of your cases, and I know you're doing a lot of pinhole also. So
thank you very much.
Let's see it.
This is actually an interesting case because you can see the eye teeth, the canines were the ones that really receded so significantly there. And we do see a lot of that just because of their positioning in the mouth. So those teeth receded, and we're able to actually get some really nice root coverage on those. So that's something that looks much more natural. It looks healthy, it looks natural, and the patient was very, very happy with that result from an aesthetic and even a healthy and functional point of view there to be able to thicken the gums too.
It looks like a really great result. And these cuspids, the eye teeth, are not easy to do, especially lower eye teeth, because in the lower, we have gravity against us as well as a muscular pull against us. So eye teeth, upper or lower, are much more difficult.
No, I mean, that's nice you mentioned that because it takes experience with this technique and with any technique to know what you can accomplish reliably, predictably, and if you go to somebody who's not as experienced, they won't be able to recognize limitations and different things that you have to worry about, like the muscles pulling, the gravity pulling against things. And there's different things that we can do to mitigate that, to actually manage around it, that a lot of people don't know about. So when you get a pinhole done, when you get any recession coverage done, you definitely want to go to someone who knows what they're doing, who's got a lot of experience with it. You don't want to go with someone who just took a weekend course and they're just trying it out for the first time. You definitely want someone who knows what's going on.